Comprehensive Community Action was created in 1965 through the Economic Opportunity Act under President Johnson. And our specific goal of community action agencies was to eliminate poverty, to mobilize all resources, whether they be community-based, financial, or governmental resources, towards that end. We started in December of 1965 with a $25,000 grant to do well baby checks out in Western Cranston. And over the last 50 years, we've evolved into a $25 million multi-service agency with a staff of over 350 and a 15-member tripartite board. In 1972, we opened our first health center in Cranston at 1090 Cranston Street, where we currently are located in Cranston. We opened our second site in the 80s in the town of Coventry. The town had asked us to build a health center there, and we quickly responded. And then we opened our site in Warwick much later. We were able to receive FQHC status and 330 funding through the federal government, through HRSA, the Health Resources Service Administration, for all of those 3 sites, which really enabled us to expand and to provide more services. It also enabled us to get federal malpractice insurance on top of that. A few years ago, we took over the Primary Care Partners Health Center, which was located within the Kent Mental Health Center. We applied for FQHC status, received that along with $330. So part of our focus is not just providing primary care to patients, but also trying to treat the entire person. So we merged our behavioral health centers into the health center system so that we can provide not only primary care, but behavioral care integrated into the care of this person, so that when a person comes in, we try to treat the entire person, body, mind, and spirit. And the health centers roughly make up about half of the agency now, and we have 4 sites, 2 in Warwick, the 1 in Coventry, and the 1 in Cranston. Along with primary care and behavioral health, we have a large dental component. We have a dental clinic located in Cranston and in the Warwick site, and currently building a new one in Coventry. We also have West Bay Smiles, which provides a dentist in the schools, along with the Molar Express, which is a wonderful program through Ronald McDonald Foundation. And it is a mobile dental operatory, 2 operatories that go around to the Title I schools that provides free dental care for these children in all of these schools. And it's a partnership between 3 of us. It's us, CCAP, along with East Bay Community Action and Thunder Mist Health Center. So we cover a big portion of the state with that program as well. Head Start was one of the first programs that CCAP ran, and we started in the basement of a shoe store on Rolfe Street and quickly expanded. We currently have 3 sites in the city of Cranston. We are the largest child care provider in the city of Cranston. We have a site at the old Mae Westcott School at 48 Atwood Avenue, in the Pastori Center on Gansett Avenue, and at 7 Hills on Norwood Avenue in Edgewood. And we see about 260 children each year. Along with that, we have an extended daycare program. So after Head Start ends during the day, those children can stay on in a daycare system up until the end of the day. We were successful in receiving funding for pre-K classrooms funded through the Department of Education, so those classrooms are available as well to children who may not be eligible for Head Start or who want a different type of experience. It's a large component. Our teachers are all bachelor's level teachers. They're all certified teachers and provide a wonderful experience for these children. And that's just for the city of Cranston only. The family development component is a much varied component. There are a lot of programs within that system. We have the Family Care Coordinating Partnership, which is a program funded through DCYF, where we provide interventions to families who are involved with the department or at risk of being involved with the department, providing a variety of services, particularly WRAP services for those families. We have the Youth Diversionary Program, which provides services to kids who are at risk of being involved with the juvenile justice system. We get a lot of referrals from the police department and from schools. Those are a little older kids. One of the bigger components in the family development piece is the Learn to Earn component, and that is our youth centers. We have 4 youth centers funded through the Department of Labor and Training, really the WIOA boards, the Workforce Investment Boards. And we have 1 in Cranston, 1 in Providence, 1 in Warwick, and 1 in Pawtucket. And those sites serve kids who are coming to us for GED services along with job readiness, job skill development services. So we provide those types of training programs to those kids, try to provide internships for those kids, and then eventually jobs in their GED program. So it's a successful program with a broad reach throughout the state. The Providence Youth Center actually is located within the Providence Place Mall, so it's a perfect site to really capture these kids because that's where they are. We're in the process of expanding that program with hopes of maybe expanding it to adults in the future. Our social services department is really the frontline department of most community action agencies. That component provides a lot of very basic services that clients need. LIHEAP, the Low Income Home Energy Assistance Program, provides people assistance in paying their heating bills throughout the season. Along with that is the weatherization program. If you're eligible for LIHEAP, you're usually eligible for weatherization, where we go in and we winterize your home to reduce your energy costs. Along with that is the EMS program, where we'll go in and replace some appliances and light bulbs and that type of thing. To supplement that is our food bank. We have a very large food bank with a lot of donations coming in, and people are eligible for food once a month at this site, at the Doric Avenue site. During tax season, we provide tax preparation in the EITC program, where people can come in and apply for that type of tax credit to give them a bigger return. The social services component also has the CCAP Holiday Giving Program, which kicks off usually in September, where we begin to ask for donations for both Thanksgiving and Christmas. At Thanksgiving, we give out a lot of Thanksgiving baskets along with turkeys, and we get a lot of volunteers to put those baskets together. At Christmas, we try to adopt families. We ask all of our components to submit names of families, and we try to match them with donors so that those families are able to give gifts to their children for Christmas, along with food as well. CCAP's motto is "We are a helping hand to those in need in the community," and I'd like to thank those who have been a helping hand to CCAP, all of our donors. Thank you so much for your generous contribution and your commitment to our services. Without your help, we would never be able to provide the level of services and to see the number of clients we see. Thank you so much.